Welcome to PROCURE Health Talks, a webinar specially designed for men affected by prostate cancer and their loved ones. The various topics covered in these webinars are intended to provide reliable information based on the concerns and questions asked to PROCURE healthcare professionals. Let's begin.
Hello and welcome to PROCURE Health Talks. My name is Kim Sullivan, and today we're going to talk about sexuality following prostate cancer. We know that side effects related to sexual functioning following prostate cancer treatment can include decreased libido and or erectile dysfunction. Those effects can have a huge impact on men and their relationships. Can sexuality take on different forms and stay just as fulfilling for one or both people in a relationship? How can we stay in good sexual health, and how can we adapt to live with those changes before, during, and after our disease? Today, we're going to talk to Audrey Epars. She is a sexologist at the Rive Sud Sexology and Psychotherapy Clinic in Montreal. Welcome. Hello. Welcome to PROCURE Health Talks. We're going to start with a very simple question. When should someone see a sexologist? Kim, it's a great question because when someone receives a prostate cancer diagnosis, they first feel very overwhelmed. They have so many questions, and it's important to have someone who can answer those questions, especially because right after that diagnosis, we might have questions about survival rates, success rates of our treatment, but also what impact those treatments might have on our sexuality, on our relationship, on our love life. So right from the beginning, we really suggest that you go see a health professional, a sexology professional, so that you can ask those questions and even talk about your concerns about the future of your relationship and your sexuality. Because it's often the second thing you think of. First, you think, am I going to die? But the second thing is, can I still have a good sex life? Exactly, because there are impacts. We can't hide that. Following those treatments, there are impacts that may last for a while, sometimes 1 to 2 years, depending on the treatment, to eradicate that disease. But some of those effects are going to be permanent. So it's important to have all of those resources, all of that information, so that we can know what can I do to get back that intimacy and a fulfilling sex life. And if someone goes to a sexologist, is that alone or with their partner? It's a good question because sometimes you have questions, and sometimes it might be better to go alone for the first time, just individually. But that depends on your needs, and if you see that there's an impact on your relationship, you might want to go with your partner so that you can get help with that kind of dynamic that's going on between the two of you after that diagnosis. So you said at the start you might want to go alone. So I assume this is more than one appointment? Yes. So here's how it works when you consult with a sexologist. Of course, you can look on the Professional Order of Sexologists of Quebec website and you can contact someone. There are people there who are professionals who specialize in sexology and also in oncology. So depending on your needs, you can find the right person on that website and give them a call. So at that initial contact, of course, for that person who is going to be supporting you, it's important to see if you click with them, if there's good chemistry, because it's also taboo, stressful. Yes, you're making yourself vulnerable, but it's also the sexologist's job to create that trusting relationship, a safe environment, and confidentiality, because these are very delicate and personal subjects. So during that first phone call, the sexologist will ask questions to understand what is going on with you as a person right then. And would it be better to initially go alone with your partner, maybe alternate between the two when you're having those initial appointments? I assume that the stress of the illness can work in favor of therapy, but it could also be kind of a roadblock to therapy. Yes, stress is a good question because you're going through so many emotions, so many things during the treatments and right after you get that diagnosis. So, we also work on that stress during the appointments, finding out what's going on. We talk a lot about that person's emotional state and help them express it. I'm not going to lie. Often for men, it is harder for them to pick up the phone and make that appointment and ask for help. We really encourage people to do that, but often if that patient has a partner, that is the person who is going to make that call. So don't hesitate to make that appointment because it can be really comforting, supportive of your well being, and to work on that stress. When you get the diagnosis, even if there's no impact on your sexuality or there won't be one, it helps you feel in control of the situation, of your sex life, and your relationship. And I assume that that control gives patients back some desire, some hope. Yes. And then desire isn't necessarily just biological. Sometimes the desire just isn't there, especially if you're going through hormone therapy. It's one of the impacts, but aside from that, during treatment, then desire should come back after the treatment. But so often, what we see is that all of those impacts, self esteem, the impact on the relationship, thinking about the future of the relationship, it creates a lot of challenges that create a loss of desire. So then we're more talking about psychology than biology, and we can work on that in our appointments. So, to wrap up, would you say the faster you see someone, the better? Yes. So, what we see for treatment, we can have positive effects for the patient. It can give them hope, and a lot of things will get better. So, now let's talk about the impact of sexual problems on men and couples. How can men in prostate cancer treatment keep a good quality of sex life and self esteem despite the diagnosis? So, of course, we're talking about different impacts both on desire and or erectile dysfunction. There are a lot of tools that we can work on in our appointments depending on that consultation with the sexologist. We're going to try to understand what's really at the root of what the person is going through. We might think it's biological, but there might be aspects that are influenced by the relationship, by self esteem, by sexuality challenges, and thinking about the future. And we'll work on all of those in our appointments. So, what are the emotions that men most often feel or that you most hear about when they're having sexual problems? I would say shame and guilt. That's really what we hear a lot of. We work on that a lot in our appointments because it has a big impact. That is what can then cause that loss of desire in men going through treatment because it's that image, the image of your masculinity, that self image, the impact of the disease, and also the treatments and their side effects that can have a huge impact. So that contributes to that shame and guilt of not being able to satisfy your partner's needs and have the same sex life that you had before. It's crazy to think that sometimes the person who is the patient, the victim of this disease, feels guilty because they can't satisfy their partner because you're a couple, but the other person doesn't have cancer. It must be a really difficult dynamic. Yes, that's what we work on when we're doing couples counseling, understanding and acceptance. Acceptance because sometimes we might never accept our situation, but to at least accept that we have different, that things have changed, that life is different, and that we can get that quality of life back, and to have a sexuality that is satisfactory as a couple or alone. I bet that that's where the partner has a critical role. Yes, that's what I was going to say. So we work on communication, to name things and to not leave things unsaid. So sometimes we see that the impact of the disease, the treatments, it's a challenge because we're going to go through things as a couple as well. Or there are things that we don't talk about, things that we're not satisfied with. So we work a lot on communication so that that couple can talk about the challenges that they're going through and really name that shame and guilt. It lets the partners understand what's going on and see things from the other person's perspective. Then, like any couple, there can be little problems, things we don't talk about during our daily life. It's not necessarily just the cancer diagnosis that brings on those problems. Not at all. That is what's important, to be able to talk and to trust each other. So sometimes we don't know, we don't have the skills to talk about those things with our partner. So we work on those skills in our appointments. Let's talk a little bit about those skills, or maybe specific advice that you could offer your patients who are going through sexual problems related to diseases like prostate cancer. Do they all have things in common? Yes, we work a lot on mindfulness. So, feeling your feelings, focusing on what brings us pleasure other than sexual or erotic things. We work a lot on that. And we're really now, as sexologists, talking about the third wave approach. We really want to focus on the person, what they're feeling, the connection with themselves and their body. And that also is going to eliminate those factors that cause a loss of desire. So often we're talking more about the psychological component, psychogenic factors. So working on that connection with our bodies. There are different tools, different exercises that we can use. And Kim, I just wanted to remind people that it's different for everyone. So in our appointments, we're going to try to learn as much as we can about that person, who they are, what makes them happy, and what they want in their lives to help them cope with this. So I would say it's really important, and it's really case by case. We definitely have some general tools, but what we really want to do is use tools specific to that person, like my mindfulness example. But there are a lot of things that we can do. I heard you use the word exercise. Do you mean a physical exercise? Something really is like doing exercise? Yes, it could be. Mindfulness, different exercises that we have to help people really connect with themselves. One that is pretty well known is the focus on sensations. I'll use the English word because it's a little better known. It's sensate focus. And we adapt that to every person who's working with a sexologist. And it lets that couple, when we talk about tools and skills, it lets them get in touch with those sensations, create sensations for their partner and vice versa, and focus on something other than our genital organs and give that erotic satisfaction in other ways. And those physical exercises like pelvic, Kegel? Yes, yes. Can that help too? It all depends. That's an exercise that we might talk about, Kegel exercises, but it depends on what the problem is, whether it's premature or delayed ejaculation, other methods that we can use. Yeah. You know your subject very well. Yes, I know my subject well. So I also know that sometimes we have to change our lifestyle a little bit, adapt how we do things. Sexuality is a really taboo subject. For example, if I asked you, how did you learn about sexuality? A lot of people will say school. But otherwise, we have people who look on the internet and things like that. And we really need information on our sexuality. There are basically as many forms of sexuality as there are people on the earth. So finding what we like, what we want, that means means opening our minds. And so I suggest to people to go get information and to know, like, what do I like? What would I enjoy? What are my desires? And how can I explore that? Because really, our education didn't allow us to get into detail about that. And it's normal because it's not a topic that we talk about with just anyone. And so with a sexologist, we can really go into depth about it because it's not something we talk about with just anybody. And sometimes even with our partner, all those unsaid things, it can be hard to go into detail. What do I want? What do I need? What would I like? How can I name my needs? And those are things we can talk about. It's so interesting. Thank you. It's a pleasure. Now let's talk about the importance of intimacy versus sexuality, because I assume that that's something that you talk a lot about in your appointments. What is the difference between those two things? And how can they really have an impact or be important for men who are in prostate cancer treatment? Definitely, we are going to work a lot on intimacy. We often work on our own sexuality more than intimacy. So we're going to try to bring those two together a little bit and try to find a happy medium, right? Because we don't want to just talk about sexuality or the mechanical aspects of it. We want to see something broader, tenderness, seduction with our partner, and even with ourselves to work on our own intimacy so that we're not just talking about the sexual side. That's really important. We're going to try to bring those two things together and work on those skills so that we can be more intimate than sexual sometimes and meet our own needs. And sometimes we tell ourselves, maybe I'd like to have an intimate moment with my partner. And sometimes we'll have that sort of mental reflex that tells us that will definitely turn into something sexual. But over time, we learn that there's not really that obligation. We can be satisfied just with an intimate moment. It takes out a lot of pressure because one of the major challenges with prostate cancer or treatment is performance anxiety. So we really want to remove that and we want to focus more on intimacy and that connection with the other person. That is the most important thing in the relationship, to develop that aspect rather than just the sort of mechanical sexual aspects. And while we can develop that, and then we try not to put on any more pressure, we could be satisfied with just that intimate moment without it becoming sexual. That's funny because one of the best pieces of advice I got when I talked to a couple who had been together 52 years was that you can have an intimate moment just by sitting on the sofa with your partner. So you might ask yourself the question, how can you be intimate just by sitting next to someone? But when you learn about that, it can change your relationship. Yes, definitely. We talk about learning things like that, how to be right next to our partner on the sofa, but taking away distractions. So sometimes it's the TV, our phones, the bed, so we want to be satisfied because we're on our screens, and no judgment there. Sometimes we want to be on our screens and it's healthy for us. So we don't always have to be doing something together when we're on the couch, but we want to look for that connection. We don't have to be talking. We could just look into each other's eyes and be vulnerable. And Kim, I just want to tell people it's not easy, but working on that connection and being sometimes quiet together, hold hands, touch each other, and have those tender moments, it's really important. And the TV is a good example. We don't want to forget that we could have a date night just at home. We could have a really nice time at home, especially if we're really busy, for example, with kids in life. We want to spend some time together. And sometimes in life, we have challenges, we're worried, we want to just relax in those moments with our partner. And that is really important. And how can the loss of sexual function, how does that most affect the couple? Is it that your lifestyle has to change? You lost a little bit of yourself? So that loss of self-esteem and self-image, it can be different so that we're not offering our partner a good enough quality of life. Yes, all those challenges that we have with guilt, feeling inadequate for our partner, and that pressure can come from our partner also, or we feel that the pressure is coming from them. So that is a factor that is really important to communicate and develop better intimacy or better sexuality also. And I remind people that's always possible, even after a prostate cancer diagnosis or treatments. So for you, communication has a huge role. Yes, I usually say it's like foreplay because, right, we hear that term foreplay a lot and we feel like that's what comes before penetration, before we have sex, that we just, have some foreplay. But that could be communication, seduction, something erotic and intimate, and we can really be playful with that. And it doesn't have to go in any specific order. That's what we see in our appointments also. We talk about that. We talk about different ways of doing things, how people want to do those things. Because as I said, everyone has their own situation. Every situation is specific to every person. And so we want to talk about what people want. And I would think that that really it breaks the ice because sometimes it's so uncomfortable just talking to a stranger, but someone who you trust and you don't want a disappointment. Maybe it breaks the ice and it makes fulfillment easier. Exactly. It takes off so much pressure, performance anxiety, because we're on the same wavelength with our partner. We know what both of us want, how both of us see the situation. I also recommend to those partners to go individually look for information as well. It's not only up to the person with the cancer diagnosis to look for that information, but their partner can also play that role of supporting and seeing what they can do. What can I do for you? Is this what you like? Should I do something different? How can I be there for you, there for my partner? And aside from communication, are there alternative therapies that might be helpful? Meditation, yoga, relaxation, do those help? It's an interesting point because sometimes we tend to think of those as more spiritual things. And everyone needs something different depending on their spirituality and their beliefs. But that I will tell you that the recommendation for yoga goes along with that third wave approach I was talking about: cognitive behavioral therapy, working on mindfulness, letting go, getting that connection back to ourselves, which is not always easy to do, but we can work on that. And so then we talk about exercise, but also our lifestyle, taking care of our physical health and nutrition. I'll talk to people about that sometimes. And of course, it won't be the sexologist who's going to give you nutritional suggestions, but it's part of your overall health. The sexologist will work on the sexual side, but will also encourage you to work on other things for your well being. It's funny because when you were talking about that, I had this realization that when we talk about intimacy and how it's different from sexuality, but how yoga and relaxation, meditation can help us connect with ourselves, and that could become an intimate moment to share it with our partner. Yes. And that disconnect sometimes leads to the loss of desire and erectile dysfunction. And there are other things, but we do specifically see that. And you can talk to that with a sexologist and say, here's what's going on with me. And it's important to get a good evaluation and see what is causing those sexual problems. So, do you have any advice for keeping up a good relationship as a couple despite those difficulties, despite going through prostate cancer treatment? I would say don't try to do it all yourself. Don't hesitate to consult with a professional who you trust so that you can talk about what's going on, understand what's happening to you, because there are so many things that you have to deal with when you get that cancer diagnosis. So maybe we want someone to just reassure us, give us reliable information, and to help us as things go on. So, one of those things would be to have some appointments and talk to each other. I think that communication is the most important thing, talking to our partner about what's going on with us, what we're experiencing, and get some help. Communication is hard, but it's worth it. So, before we let you go, Audrey, I have a last question because we've talked about partners. Should we go see someone alone or in a couple? But what about our single friends? That can't be easy. It's a great question because, for example, on a dating site, you're not going to say, here's what's going on with me. I have erectile dysfunction. I have no sex drive. I have no libido. So it's not easy. But we're going to work a lot on self confidence in our appointments. And so then I think it helps us see that we're not just our cancer, we're more than just a disease. So when we talk about mental health and working on all of those aspects that make us a good candidate to be in a relationship, it's really important to work on that component. So I would say that when we meet someone, we're not necessarily going to make ourselves vulnerable right away, or there are things we're not going to talk about in those first few encounters. But it's important that we feel a connection with that person, our new potential partner, so that we can take our time. And in that situation, we're going to talk about what's going on in our lives, and gradually we can start to talk about these things. And we can also work on that in our appointments. So I know I've said this before, but to help us figure out how to talk about those things directly, because again, it's a case by case thing. Some people are going to be very at ease with that and they're going to have a good reaction from the other person, but some people that's not going to be true, or they're afraid of the reaction. We're afraid of being rejected, and we don't want to be judged for what's going on with us. So it's normal to not necessarily want to talk about this right away. So I assume that understanding that intimacy and sexuality are different is going to be true for someone who's single. Yes, it's really important to have that intimate, sexual component with someone who we're attracted to, who we want to be with, who we want to grow in a relationship with. But we also, we can't forget that there are a lot of treatments there. And if you have erectile problems, sex drive problems, we can work on that in our appointments. There are medical aspects of the treatment that can cause erectile problems, but, don't forget that it can be a result of that treatment. Thank you, Audrey Epars. Thank you so much for being with us today and to help us understand that erectile and sexual dysfunction is a major source of concern for many men with prostate cancer. I hope that this short webinar was useful to you. And of course, you can call our free helpline, which is open 7 days a week. If you have more questions, Procure's nurses are there to answer you confidentially. Thank you.
We warmly thank our experts and our partners for making this webinar possible. To find out more about the tools and resources available to you, or to make a donation, visit procure.ca. Thank you for your support.